Hi, this is Dr. Christopher Maloney. I want to talk to you a little bit about carpal tunnel syndrome and also repetitive strain injury, also called BlackBerry thumb today, but Blackberries are probably on their way out. It'll be smartphone hand next, or our tablet fingers. What happens is when you take the small muscles of the wrists and hands and you overuse them over a period of months and years, and you do that in a context where your shoulder and your neck are not in the right position as well, that will lead to chronic pain. Or you can also lose your feeling in your hands. You can also have pins and needles, and or in the worst case scenario, your hand can just stop working appropriately. It just doesn't respond to the signals from your brain in the right way. So any of these are repetitive strain injury. The idea of treating repetitive strain injury is, in most cases, that people do surgery, and surgery isn't actually that good an idea, because what happens is that you release your carpal tunnels in your hands for carpal tunnel syndrome. The trouble is the person continues the poor habits, and they go on and have other things, an outlet disorder or repetitive strain injury elsewhere. What you really want to do is look at your habits as well as what's blocked. I can release what's blocked manually. I don't need a surgical thing to do it, but it will retighten itself unless you change the way you're doing things. Now, why should you change the way you're doing things? Because basically it's causing the whole system to have chronic pain. You may be experiencing it in your hands, but your shoulders, your wrists, your neck, your head are all experiencing that strain as well. And so getting that early on and not doing it for the next 30 years is a really, really effective way of avoiding future pain, as opposed to simply having a surgery done to one aspect that's going to lead to pain elsewhere in the long term.